Hi, I'm Dr. Tiffany at Bridge to Health Chiropractic and Smart Living EDU. Today I want to talk to you guys about something called spondylolisthesis. Really big word, we usually just call it spondylo, but it can have a really big impact. All over the place I hear about sciatica, and there's a lot of different reasons for sciatica, but this is the one I think that's missed a lot. And so I've got my skeleton here, my friend that's been with me for a really long time. There's a bone right here, your L5. This is the one that's most common. It can happen at different bones, but this is the one that when it slides forward, that we actually grade that out. I'm gonna put that back on there. There we go. When that slides out and moves forward, it causes a little battle going on between the sciatic nerve, the piriformis muscle, and also the psoas. So you've got muscles in the back of the spine, you got muscles in the front of the spine, and then this nerve that's really important that are going through this back and forth, where as one tightens, the other one is stretched, and then the other one will do the opposite. And you know this could be you because like you go to a massage therapist and you're like, I'm always tight right back here. They rub it out, but it keeps coming back and I have this sciatic pain. Or when it finally loosens up, you realize that the front, your hip flexors are tightening up on you. That's because they're guarding, they're protecting you. And we have to unravel that battle that's going on. And the only way you really know if that's what's causing your sciatic pain is by an x-ray. And this is one of the many reasons why chiropractors use x-ray. When you come into my office, a lot of times I'm gonna take a picture because, you know, my sense of touch is really good. It's not that good though. Not x-ray, not happening. But my digital x-ray takes beautiful images and we can catch this. And this is a totally different treatment plan. It's not just like going in, finding where you're out of alignment and adjusting. It's actually working that whole area and then retraining those muscles. So if you're having that sciatic pain and you've gone massage therapy and you've done all sorts of different things, muscle relaxers, which just are a bad idea anyway, and you've done all of that and it keeps coming back, you need to come get checked out by a chiropractor that does x-rays, and it's a real easy check of whether you have a spondylo or whether you don't. All right, hopefully that's helpful for you, or if you know someone that you've been hearing them talk about for a long time, their sciatic pain that never goes away, share this with them so they can have that information and also check it out for themselves. All right, have a great day.